I am super excited for tonight's event, skincare and breast cancer, something that I feel like affects so many of us, yet it is just one of those topics we just never speak about. I myself, when I was going through treatment, I had what they called chemo rash when I was on Taxol, and anytime I went outside, the sun would touch my skin, and I would get red patches all over my body. Um, as I do work with La Roche-Posay, I talk so much about that, and it kind of hit me where it was like, let's make this an event. I know Dr. Garshick. She also does a lot of amazing things. If you guys aren't following her, please do. Dr. Marisa Garshick on Instagram. She does the dermatology. I also love dermatology. I feel like dermatology is always making me give me that like glazed donut look. Also, shout out to La Roche-Posay. A big thank you to La Roche-Posay for sending us over some oncology kits. We are working on getting more out, so hang tight. You heard it here first. I said it on the recorded video, so you know I can't be fibbing you guys. I know some of you guys attend that are here have some of the product that was sent out. So without further ado, I would like to introduce Dr. Garshick. Dr. Garshick is a leading board certified dermatologist in New York City, practicing at the Medical Dermatology and Cosmetic Surgery Center, and is a clinical assistant professor of dermatology at New York Presbyterian Weill Cornell Medicine, and completed her residency training at Weill Cornell Medicine and Memorial Sloan Kettering Cancer Center. Dr. Garshick sees patients of all ages, focusing on medical and cosmetic dermatology. She has a passion for being able to improve patients' quality of life and loves to help her patients look and feel their best and the best version of themselves. Dr. Garshick has numerous publications in scientific journals and book chapters and has presented at national meetings. Additionally, she has previously worked for the Dr. Oz show and is regularly featured in top media outlets such as Glamour and Style, Huffington Post, Women's Health, Allure, Elle, Prevention, Harper's Bazaar, Shave, Refinery 29, and more. She has been selected to the New York Super Doctors and is recognized as a Castle Connolly top doctor. Woo! That is quite the intro. So without further ado, Dr. Garshick, welcome.
Thank you. Thank you so much to Kelly for hosting me or having me hosting this. This is incredible. And I'm thrilled and honored to be here, to be able to really be here for this community and answer any and all questions that you may have from beginning to end in terms of wherever as we go. We'll kind of try to touch on different parts of the skincare and breast cancer journey. And wherever you have a question, either drop it in the chat, but the goal is really for me to be able to answer the questions that you have. And yeah, I would say it's something that I think skincare in general can be a very overwhelming topic to begin with. And I think once you layer in different stages after receiving a breast cancer diagnosis, whether it's in the setting of treatments, whether it's in the setting of the diagnosis, surgery, radiation, and then survivorship, I think there's so many different layers to unpeel. So obviously we'll do as much as we can, and we'll try to capture as much as we can throughout this time. But without further ado, I will start really with kind of the first thing that I find that happens once people receive a diagnosis of breast cancer is often the first question is, should I stop anything? So as it pertains to skincare, there's this question of, did something I do cause this? And I would say the biggest thing is that when it comes to skincare and beauty products, while it can be confusing and there's a lot of information out there, there's also a lot of misinformation out there. And at this time, there is no conclusive data to suggest that anything we are putting on our skin is getting absorbed in high enough quantities to necessarily cause an issue. And so I think that's always a good place to start, because whether it's in the form of antiperspirants or products that you're putting on your skin, hair, all of the above, I think ultimately it doesn't necessarily mean that just because you received a diagnosis, you have to stop these things. Um, that being said, I think it's very important to also do what's best for an individual. And I think there's a lot of situations where people maybe prefer to stop things just because it gives them a sense of peace and a sense of control, and that's okay too. So ultimately, it really comes down to whatever helps you sleep better at night. But I will say that at this point, we don't have enough information to really say there are specific products out there that you have to avoid, just by virtue of a diagnosis. So now, as we sort of transition into kind of once we have a diagnosis, what's happening to our body that maybe makes it more vulnerable or susceptible, and how should we be caring for our skin during that time? And again, questions as we go. Feel free, if anything I already said you need me to stop, happy to. I know we'll have time at the end, but anything that feels relevant, feel free to put it in the chat, and happy to address it as we go. So in terms of radiation, so radiation is sort of a important topic when it comes to the skin, partially because what you're putting on the skin sometimes can actually affect your radiation treatment, and your radiation treatment can actually affect your skin. So I think it's important to always remember that radiation is obviously critical and important to the treatment process, but we also know that it can cause harm to the skin, and we want to be extra mindful and cautious about that. And so when undergoing radiation, you do want to be extra gentle with your skin. And again, that's partially because you don't want it to be extra sensitive to the treatments themselves, but you also want to make sure that obviously with the radiation treatment making your skin more sensitive, that you're being careful in that setting. So with that being said, I usually recommend using gentle cleansers, avoiding harsh soaps or abrasive scrubs. So if you're somebody who's previously used like a physical scrub, something that has the little like shells in it, or even exfoliating washes, so things that have like salicylic acid or glycolic acid or lactic acid, all of these sometimes can be a little too harsh on the skin, especially as it's going through radiation treatment. I often will also recommend avoiding things even like washcloths. So just really using like a gentle body wash, even like applying it to your hands and using your hands to wash. And that's totally fine, totally acceptable, but especially good for that gentle skin. You want to make sure the water you're using in the shower is lukewarm. So the same way we treat for people who have dry skin, we always recommend short showers, 5-10 minutes, lukewarm water, and making sure to moisturize the skin as soon as you get out of the shower. We sort of use that same idea in the context of when we're treating our skin as it goes through radiation treatment. And the idea here is that we're trying to strengthen and support the skin barrier. And when you shower, especially with hot water, you're disrupting that skin barrier and making it more irritable, making it more sensitive. So the way we repair that skin barrier, whether it's being disrupted by the shower or by radiation itself, is through moisturizing creams. And typically we find that creams and ointments are preferred over lotions because they provide that protective barrier to help lock moisture in. So while you're undergoing radiation treatment, that's important to keep the skin strong and robust. But it's also especially important after having radiation because your skin is going to be a little bit weaker. It's going to be a little bit more sensitive. I mean, you create that protective barrier, you're creating an actual physical protection for the skin against external irritants. So that could be even clothing rubbing up against it, or it could be other ingredients that might come into contact with the skin. When we think about moisturizers, we usually like to think about certain ingredients to look out for. So that can include things like ceramides, which we know are these little fatty lipid molecules that make up our natural skin barrier, but when they're found in moisturizing products, they help to restore and strengthen that skin barrier. Other ingredients, niacinamide or Centella asiatica, which has a calming effect. And so in the La Roche-Posay products, they're in their Cicaplast, which is one of my go-to and one of my most favorite creams, especially in the setting of radiation treatment, that has some of the Cica, the Centella asiatica, which we know is very calming on the skin. Another product that I happen to like is a prescription in the US, but it's also available in like a French pharmacy. So if anyone happens to have somebody traveling to Europe to pick up, it's something called Biafine, and it is available here too, but that's another great wound repair moisturizing cream that can be really great in the setting of radiation. The big thing with radiation is that after treatment, there is always the risk of, well, during treatment, I should say, radiation dermatitis, which is something that if you do experience is definitely important to check with a board certified dermatologist or your radiation oncologist, because oftentimes it can be helped with more treatment than just a traditional moisturizing cream. And then after radiation, it's important to still be very gentle with the skin. When you're going through radiation, sometimes the skin is more sensitive to the sun, but even after it can be as well. And we do know that having radiation can sometimes increase your risk of developing skin cancers in the area. So that's also important to always be extra cautious with the sun. Obviously, always good to see a board certified dermatologist anyway for skin checks, but this is definitely a reason to make sure of that as well. And then, so we'll kind of
I just
break
want to jump
there.
in real quick,
Yes,
Dr. Garshick. Someone just said, can you just type in the name of those
yeah,
lotions that you just referenced?
absolutely. I'm going to do La Roche-Posay Cicaplast, and I can also towards the perfect Kelly. Kelly, if you can go back to France, you can get some Biafine for everyone.
I was just, I'm always trying to go back to France, but I wanted to echo like French skincare in Europe is just elite. And so if you know someone that's going over there, be sure to tell them to get you all the stuff, including the deodorant. Like their deodorant is like the best.
I'm also going to include, so Aven, speaking of French companies, is another great brand that also has a similar type of repair balm called Cyclefate. So the Cycloplast, Cyclefate are really both very gentle on the skin, super soothing. They're both made with their individual prototypical thermal spring water, which is known to have calming and soothing benefits. And they actually each independently have done studies in the setting of individuals going through cancer treatments, whether it's through radiation or chemotherapy, showing the benefits of the thermal spring water on the skin for individuals. So great brands in general, but also in particular, especially when going through radiation, these can be really great healing balms. For ceramides, CeraVe is another great brand. So CeraVe moisturizing cream. So that's also great, obviously, for the whole body, but also great for that as well. Cicaplast is okay on the face. I would say it may not necessarily be needed as a routine moisturizer on the face, but definitely fine, especially if the skin is feeling raw or irritated. La Roche-Posay has a slightly lighter weight lotion called their Double Repair, which I'm going to put in the chat now later. And that I would say is more of an everyday, whereas the Cicaplast might be more if you're experiencing like irritated skin. The nice thing about the Toleraine Double Repair is that it also has an AM version and a PM version. So AM already has SPF built into it, while the PM version does not. So if you already have a sunscreen that you like, you can just layer the PM version. And it looks like we also had so spray tans or self tanners, okay, after active treatment is complete. So I would say in general, yes, after treatment is complete. Now, in general, spray tans are the safest type of tan. So we'll kind of go over this, but the idea really is that tanning beds, sun, all of that in general is not great for your skin, but especially when undergoing different types of treatments that make your skin more sensitive to the sun. So whether it's through radiation or chemo, even having just surgery makes your skin more susceptible to sun damage. So you do definitely want to be mindful of avoiding the sun. But if you are somebody who likes to have a glowy finish, spray tans and self tanners are okay. The reason to avoid it while actively undergoing treatment is that some of the ingredients can be a little bit irritating on the skin. So better to wait if possible, just because you don't want to cause any. You may have never had an allergy or sensitivity to it before, but because your skin is sensitive during the time of treatment, it may be more reactive at that time. And then with antiperspirants, so what I would say is, so antiperspirants, deodorants, the concept of aluminum, I think certainly there's always this idea that we don't have enough information at this time. But what the information we know right now shows that there is no greater increased risk of breast cancer in the setting of aluminum. Now, the thought being is that we maybe don't have as we're not getting as much exposure, so we're limited exposure, and that's why we don't necessarily see any potential risk there. Now, that being said, the FDA still incorporates aluminum into anything that's officially considered an antiperspirant. So anything that does not have aluminum is considered a deodorant. And so the specifics of that really refer to this idea. Antiperspirants are actually going to block sweat. Deodorants are going to mask odor. So if you're somebody who's very sweaty and is looking for something to help block and reduce that amount of sweat, an antiperspirant, which by definition contains aluminum, is the way to go. If you're somebody who does not want to use aluminum, there are deodorants, which again are designed to mask odor, that have ingredients that help to absorb moisture. So you are getting some benefit in reducing kind of the feeling of sweat. But it is important to know that at this point, the FDA has deemed aluminum based antiperspirants safe and effective for use. So hopefully that helps. And then, so yes, I mean, the amazing thing about a lot of these products that we've described is that they're great for any time. So they're not just limited to while you're undergoing treatment, but they're really gentle on the skin. I mean, I would say, and we'll get into this as we continue on in the conversation, but what you use on the skin is always, your goal is always to be gentle on the skin. And so you always want to prioritize products that are going to be hydrating, nourishing, and minimize any potential for irritation. So having that as on the checklist, once you like this product or these products, you're good to keep them in your repertoire for as long as you want. Amazing questions though, and thank you. I love to have participation. It always helps and gives me a sense of what's important and the information that you're looking for. And I love the family in England. So hopefully they're taking care of some of those product purchases for you. Okay, so we will move on into undergoing chemotherapy. So obviously we know chemotherapy can target rapidly activating cells, which inherently are cancer cells, but are also other parts of our skin, hair, and nails. So as a dermatologist, we take care of skin, hair, and nails. And so all of the above are things that we see the effects of in the context of chemotherapy treatment. And as we described, the skin functions as both a physical and a functional barrier to keep moisture in and prevent microbes, so germs and irritants out. And so when the immune system is compromised, as it is when we're going through chemotherapy, it's even more important to support that skin barrier function to help prevent infections and further irritation. So again, gentle products are key. So things that are going to be gentle on the skin, moisturize the skin, minimize further irritation in terms of harsh products or active ingredients. And I'll go over kind of what those include. And then, as Kelly had alluded to, a lot of chemotherapies can make your skin more sensitive to the sun. And importantly, it's not just sensitive in the area where in the breast area where the treatments obviously focus, as we know with chemotherapy, it's targeting the whole body. So the effect of sun sensitivity can affect everywhere. So it's not just kind of saying, oh, okay, I'm going to wear a long sleeve shirt and I'll be fine. But your face, your hands, your feet, anything that sees the sun has the potential to have increased sensitivity, which may be in the form of a true sunburn. So what we call like a phototoxic reaction, or some people can experience a photoallergic where they develop a rash in the setting of the sun combined with chemotherapy. And then there are separate rashes, which are just considered more chemo-related rashes, which we can go over. Um, so the idea with the sun, and I think we had some questions in terms of the type of sunscreen that should be used during radiation. So during chemo and radiation, I would say mineral sunscreens, which are the zinc and titanium-based sunscreens, do tend to be the most gentle on the skin. Mineral sunscreens tend to work as a physical blocker. So they create essentially like a physical barrier to block the UV rays, as opposed to chemical filters, which often require some absorption to be converted to heat and then released out. And so that's the way that chemical filters. There's nothing wrong with chemical filters. It's just that for some people, there's a greater risk of allergy or skin sensitivity with the chemical filters, which is why we find the mineral filters to be preferred. So again, zinc oxide, titanium dioxide. Typically, I recommend SPF 30 or higher. Sometimes in the setting of radiation and chemotherapy, I will actually say SPF 50 is preferred, but ultimately the best sunscreen is the one that you'll use. So if you have one that's 30 and you're using it the correct way and you're using enough of it, totally fine. The idea with sunscreen is not just to apply it, but to also reapply it. So remembering to reapply roughly every 2 hours. Generally for the face, we talk about what's called the 2-finger rule. So essentially applying enough to kind of be the extent of these 2 fingers there, and then using that for your whole face. For the body, we usually use the equivalent of like a shot glass size. So if you were to fill a shot glass with sunscreen, that should be the amount that you're really using on your whole body per application, which generally speaking is not what most of us actually do. So the important thing is to really be extra cautious about how much you're applying. I also would add that sun protection doesn't just stop with sunscreen. I would say doing things that are protecting your skin in other ways. So wearing a hat, wide brimmed hat, clothing. So they make UPF protective clothing, and I can write some brands in here, but Coolabar.
I'm just going to jump in. I'm glad that you are talking about physical and chemical sunscreens because that's a big question that I get a lot. Because I myself, um, there's one you just went over it, but like some of them, like I have normal skin. I used to have oily skin. That was really weird. So I had oily skin before I had cancer. I did the chemo. It sucked all the oil out of my face and it never came back. So that's really cool. I appreciate that. But when it comes to sunscreens, I have to be mindful because there's one that's like, it'll make me break out. So I think is it the chemical I think you said?
So generally, I would say the chemical sunscreens may be more likely to cause irritation. For some people, it may be more likely to break them out. But what I will say, the main thing to look out for are non-comedogenic or oil-free. So for face sunscreens that you really don't want to break you out, just make sure it says somewhere oil-free, non-comedogenic. And that means that they've done some studies to acknowledge the fact that this product shouldn't break you out. Some sunscreens that I like the La Roche-Posay Anthelios. Elta MD has some great sunscreens. I'm really going to write a lot because I truly have a lot of favorite sunscreens, and I think it's really a matter of trying different ones out. Eucerin just came out with some really great sunscreens, Neutrogena. And all these brands now have really nice lightweight mineral sunscreens. They've also extended the tinted shade option. So tinted sunscreens, we know for people who maybe are susceptible to hyperpigmentation, can actually be helpful. Tinted sunscreens can also provide a little bit of extra coverage. So you don't necessarily, if you're somebody who doesn't want to wear makeup, but you want to have a little bit of that natural camouflage day to day, the tinted sunscreens can be great for that. So Neutrogena mineral sunscreen, Eucerin. and Cetaphil and CeraVe. But honestly, the list goes on. Blue Lizard is another great one, especially for the body, and they have a lot of mineral formulations as well. Let's see. I just want to make sure I didn't get the, okay. Sunscreen, yes. So sunscreen during radiation. So on the sunscreen, you want to use SPF 30 or higher. You want it to be broad spectrum. So that means it provides coverage against both UVA and UVB. And then obviously, if you're going to be outdoors, making sure it's water resistant and paying attention to how long, because water resistant doesn't necessarily mean you can go in the water indefinitely. It's usually just for, let's say, 40 or 80 minutes before you need to reapply. So you do want to make sure you're kind of keeping track of that, because that is something that when people come back and tell me, I promise I use sunscreen, but I got a sunburn, it's oftentimes related to the fact that the reapplication didn't happen. And truth be told, it's happened to me too. So it's not like we're invincible. You get busy and it's easy to forget, but just trying to keep that in mind. In terms, I know we have a few questions on more like skincare, and so we'll get into those after. I'll finish up in terms of chemo, but so I think the importance of chemo rashes are just really that if you're going through chemotherapy and you're noticing anything new on your skin, be it one spot or multiple new spots, if you're experiencing any itching, redness, flaking, anything that is unusual or different for you, that's definitely a reason to check in with your oncologist, but even with a board certified dermatologist to make sure that you're being properly treated. Many of these rashes don't necessarily require us to stop the chemotherapy treatment, so they're not necessarily harmful in that way, but there are definitely ways that we can treat you so that you're not uncomfortable or you're not experiencing any issues while on the treatment. Um, Getting back to the sun protection. So we spoke about hats, clothing, but seeking shade when possible. So finding the umbrella, avoiding peak hours of the sun. So we know that the UV index is generally strongest between 10 and 2 p.m. So if you're going to go for your daily walk, which is always a good idea, try to avoid peak hours. And actually on your phone and on the weather, on the weather app, it actually will show
The
what
UV index,
UV
right?
index is exactly. So if you see that there, it says UV index is low right now because where I am, it's dark. But definitely making sure to keep that in mind, because some days it might surprise you and it might be cloudy, it might be rainy, and the UV index is still in existence. So making sure that you want to make sure you know what that number is, and based on that number, you're wearing proper sun protection. Okay, questions on anything related to that? I see some good. Yes, so Eucerin tinted mineral is great. And yes, the Cool Organic Scalp Spray is wonderful. And I think that really brings up a great point. So obviously we know during chemotherapy, one of the potential risks is that we lose our hair, and protecting your scalp is going to be so important during that time, not only just in general, but from the sun especially. And so finding a scalp spray and hair sunscreen is great. I do love the Coola ones. There are some uh, powder brushes, which again aren't necessarily as good as a cream. So if you do feel like you're in a position where you're able to put a cream, that's still always going to be superior. But those powder brushes can be great, especially for like if you're trying to get in the part, or for reapplication. If you don't want to feel as greasy, sticks are also great options for that as well. And so low UV doesn't necessarily mean you don't need sunscreen. If it's 0, you don't need sunscreen, but usually even low, sometimes you would still want to. But the nice thing is it actually shows a little bit of trying to see, it basically will give you a little bit of a color that gives you a little guidance in terms of how high it is. And so usually if it's really anything above kind of that, I would say 0 marking, you still want to have some SPF on. Now, again, being realistic, if you're going out and it's like 5:30 and you're wearing a hat, it's probably not the end of the world. But the idea really is that because the skin is generally a little more sensitive in the sun while you're undergoing, whether it's chemotherapy or radiation, being extra cautious doesn't hurt. And in the context of chemotherapy, I think it's also important to discuss the hair. And so, one other thing that I like to always mention, even though it's generally best to still speak with your oncologist directly, but is the concept of cold capping and the idea here is for anyone who's not as familiar with it is that while undergoing your chemotherapy treatments, you apply basically cold to the scalp, and that helps to basically constrict the blood vessels to minimize the amount of chemotherapy that's getting to the scalp and the hair follicle, and may help to prevent as much hair loss as a result of the chemotherapy. So again, not everyone is necessarily a candidate for it. And so it is something that should be discussed directly with your doctor, but it is something that does exist. And I think it's important just to certainly make people aware. And and yeah, it sounds like somebody mentioned that they're cold capping as we speak, which I mean, I think it is something to note that um, sometimes it does add time on to your treatments, but for a lot of people, they have found that it's been worthwhile. And so I figured. And so it is something that I think is just certainly worth the conversation. At this time, there hasn't been any uh, data to suggest that it lessens the effect or the benefit of the chemotherapy, and so something to be aware of. And perfect. Okay, we'll move on to surgery. So surgery, whether it's in the form of a lumpectomy or a mastectomy, uh, or leaves the skin with visible scars. Now, scarring in general, I would say, can range. Some people may notice that with surgery, they don't notice the scars very much. Other people may develop what are called hypertrophic or keloid scars. And in some cases, it's hard to predict who's going to experience what. Some people may have a predisposition to thicker scarring, but some people may be surprised that this is the first scar that they've experienced that has developed that. Some things that I like to recommend for scarring are silicone gel products or silicone sheets. And so the silicone is basically what's been shown to have the most amount of evidence for scarring. The sheets can be helpful for in the setting of helping to alleviate tension. So the sheets are basically like an adhesive that goes over the scar itself, and it not only delivers the silicone to the scar itself, but by putting that alleviating some of the pressure off the scar, it helps to alleviate any tension that may be pulled with movement, and helps to maybe potentially keep the scar a little flatter. With when it comes to scar treatments, I always say defer to your surgeon. Many surgeons will be particular about when and how and if they want you using anything. So that I would definitely kind of hold off on. In terms of what can be done for the scarring after. So if you get the green light and you're wanting to do more for your scar in addition to the creams in the in-office setting, we have a few different treatment options. So we approach scars based on the color and the texture and then the thickness. So for thickness, so if it is a thicker keloid or hypertrophic scar, some ways we treat that are with cortisone injections, so steroid injections into the scar itself. Sometimes it's actually done monthly. So sometimes you'll see improvement even with just one, but it may be required to repeat it monthly for several months for the most benefit. Other treatment options for scars include laser. So for some people who notice maybe a pinkness to the scar, while that's normal and does tend to fade with time, to help speed up the resolution of the pink, which is basically just blood vessels that are new blood vessels that are coming to the scar tissue, there is laser that can be done to target that specifically. Some surgeons will have a preference as to the timing of when something like that is done. And then lastly, I would say from a texture perspective, so to sort of even out and smooth out the texture of the scar tissue compared to the surrounding skin, there are things like lasers and microneedling, which can be helpful. Now, again, these are not things that have to be done. So in general, scars are not necessarily harmful or problematic if they are not as desirable as we want them to be. Um, but these are options to obviously give you an opportunity to feel the best about the scars as you can. Um, in terms of, and so in terms of hand and foot syndrome. So hand and foot syndrome is definitely an important thing to talk about. And I think really the main thing to think about with it is that the hands are going to just be inherently more sensitive and more reactive. Oftentimes it may additionally, in addition to sort of your standard just moisturizers, and again, thicker the better. So ointments and creams, sometimes using a prescription like a topical steroid may be important to help calm some of that inflammation. I know we're talking a lot about the La Roche-Posay, but they actually make a Cicaplast hands, which is especially great because it's also calming and soothing on the skin. Sometimes if people do experience like a thickening of the skin, so more like a callus, using a, yep, there it is,
And did
Kelly's
I
got
have it in my
it.
bag of tricks?
And so, and it's great. And again, like you can do one-stop shop. Like if you have the Cicaplast, you can use that everywhere. The Cicaplast hands is a slightly thicker formulation for the hands that has a little bit more of an emollient, so like skin softening property to
Can
it.
you go over urea cream? So like I know with hand and foot syndrome, they say clinically a urea cream is the best. It's not going to prevent it, but it could help lessen it. And I know like there's different tiers of urea, and I think for hand and foot they recommend around 30%. So can you go over what all those levels are?
Yes, absolutely. So exactly. So what I was getting to is sometimes for that thickening, the urea cream is especially good because it falls into this like exfoliating product. So urea as an ingredient has two main benefits. It actually can be inherently moisturizing. So it works as a humectant, it draws moisture in, but it's also a keratolytic, which means it breaks up the dead skin cells and helps them to kind of slough away. When used at a higher concentration, you're getting more of that keratolytic benefit. So sometimes you'll see it and it might be in something at 10%, and it's really more functioning as a moisturizer, but the higher the concentration, the more exfoliating it is. And so urea 40%, sometimes I'll send as a prescription, so it can be available through your doctor as a prescription. I had a patient come back to me that they found it on Amazon. So again, hard to vet sometimes the different things you find on Amazon, but it does exist. And yes, that's the reason why the percentage is important. So I usually say 30 to 40% when dealing with it. And again, the idea there is that it's just going to soften the flaking and the buildup that's on the skin. The clobetasol is a topical steroid, so that's a prescription. So again, that's going to be important to calm the inflammation. So we know part of what drives that hand and foot syndrome is inflammation. And so the clobetasol can be used in combination to get that benefit as well. And then in terms of the Voltaren, that's more of like anti-inflammatory. So I would say that one is more, helps to kind of reduce inflammation from, I would say, a little bit more of like a symptom relief perspective. I personally end up using both the clobetasol and the urea more frequently. But again, sometimes it is the cocktail of all of the above that can be the most helpful. All right. Any questions on that? Okay, so as we transition now, we get to just talk about skincare in general, because at the end of the day, despite all of these treatments and despite everything that we go through in this process, at the end of the day, you still want to feel and look like the best version of yourself. And there are ways in which we can do that. And even if I always say to patients, if we take a little pause during this period of time, there's nothing that we can't catch up on. And so not to be discouraged if you had to stop a retinol or you had to stop doing cosmetic treatments or whatever it may be, because those things will all be there waiting for you when you're ready for them. if you even feel like you want them. And so really, I would say when we think about as we transition out of our therapy into survivorship and what we're thinking about, we get to also recognize that our skin, as we get older, changes. And so we want to focus on the same things that we would be focusing on, even if we hadn't been dealing with everything else that we've been dealing with. So, a basic, simple skincare routine typically will begin. I usually say you can do 3 simple steps in morning, 3 to 4 in morning and night. So, in the morning, cleanser. Often I'll recommend like a vitamin C serum, moisturizer, and sunscreen. In the evening, I would do a cleanser, some type of active ingredient. So that might be a retinoid, that might be an exfoliating acid, that might even just be like a hydrating ingredient if you're feeling extra dry, and then a moisturizer. And that oftentimes is all you need to start or resume a skincare routine. I think as we're transitioning out of the treatment window, one big thing is to not do too much too quickly. And that's with anything in skincare, but I especially say when you're introducing new products to the skin, only start off with one new product at a time, making sure to sort of give it 1 to 2 weeks and then work your way up as you need to, as you tolerate it, and then reintroduce other ones as you go. Introducing too many things at once, one, makes it so that if you do have a reaction, you don't know what it's to. And then two, your skin is getting used to it. You want it to have an opportunity to sort of tolerate something before something else comes into the mix. In terms of a nice over-the-counter treatment, for retinol, ROC makes a great sort of introductory retinol. And so I can write that here. Um, and CeraVe has the retinol resurfacing serum. And so
Rock
these,
has the little capsules, right? The one
and
that you're
these,
talking
yes.
about.
So
That
they
you,
have
they're like perfectly like proportions. Yeah.
exactly. So they have those, which are also great for like travel. And then they also have like called like something called deep wrinkle correction. The CeraVe, and then Neutrogena has the rapid wrinkle repair, but they also just came out with, for anyone who's either unable to tolerate retinoids or just doesn't want to use a retinol or retinoid, Neutrogena also has their new collagen bank moisturizer, which has bakuchiol, which is basically an alternative to a retinoid and a little more gentle on the skin. So it has bakuchiol and peptides, which are both also good to help build collagen and all that. So why this regimen? So the idea is as we get older, we start to lose collagen. And the idea is we're trying to do things that help to build that collagen back. So retinoids are known to be an ingredient that helps to regulate skin cell turnover. So it's good to help address breakouts. It's good to even the skin tone, and it's good to help address fine lines and wrinkles by helping to build collagen. Peptides also help to build collagen. As well as, like I mentioned, the bakuchiol as well. In terms of vitamin C, so vitamin C is an antioxidant that when we use it on the surface of the skin does help to even skin tone as well as lighten discoloration, and also can help to boost collagen. So I usually think of it as a good partner with sunscreen. Sunscreen is obviously protecting the skin from UV damage, but the idea of the vitamin C is that any damage that's taking place, the vitamin C is there to be sort of a rescue and repair. So it's protecting the skin from additional damage from taking place. In terms of sunscreen, again, kind of goes without saying. So even if your skin's no longer as sensitive to the sun as it was while you were undergoing treatments, still super important to be doing sunscreen every day. We know there's a cumulative impact of the sun on the skin, both from a skin aging, but also from a skin cancer perspective as well. So definitely important to do that. And cleansers and moisturizers, I would say don't have to break the bank. Find the ones that you like. Drugstore products are perfect for that. And I'll add to that AM skincare routine just after moisturizer to also add sunscreen. But perfect. Thank you for taking care of that. I'll try to put it in there.
I
And
would love for you to talk about vitamin C serums because my biggest complaint is that sometimes I'll use there's certain ones and then like I feel like I have like an orange cast on
Hmm.
my skin. Is that super common? Um, yeah.
Yes. So
And what you recommend and like what's your favorite vitamin C serums?
yes. So vitamin C inherently is an ingredient that can be unstable. And because of that, sometimes in the bottle, it can oxidize, which basically means it does turn sometimes it might start off as a very yellowish, pretty color, and then it sort of turns into this ruddy brown type of color where essentially it shows that it's oxidized, which doesn't necessarily mean it's no longer effective at all, but it's likely less effective and has destabilized in some way. So sometimes when we see that orange tint on the skin, it's really just a result of that natural coloring or sometimes some oxidizing that's happening when it's exposed on the skin. Sometimes it's the combination of vitamin C with other ingredients. So anything in the mix is possible. Now, vitamin C's, I would say historically, I would say cleanser and moisturizer, good place to save. You don't have to spend a lot of money. They're great products at the drugstore, all that. And it used to be that the vitamin C products were where I would tell people to splurge because it was so hard to create a formulation that was stable and effective. Times have definitely changed, and I think more companies have been able to figure it out in terms of finding a product that is both safe and effective. I would say SkinCeuticals CE Ferulic is one of the sort of
No, no one,
true.
everyone says that I've had it before, but it's like, yeah, it's the best.
So
It's a
that's the
little
one.
on the pricey end. I'm gonna be full
Exactly.
disclosure,
Yeah.
but
So that's our splurge. And I would say that's like the OG. That's the original. That's the one that sort of everyone holds everything else to a standard of. But I will say there are some, if we can call them dupes or sort of ones that have similar ingredients at a lower price point. And one is by Dermatology. So the brand DRMTLGY, and they have one called CE plus F, which is similar CE ferulic acid, so similar to the SkinCeuticals. And then the brand Maylove makes one called the Glow Maker, which is also a nice one that I've used myself as well. In terms of other ones, so I like the Vichy, CeraVe, and La Roche-Posay all have really nice vitamin C's that are available over the counter. Sometimes the concentration of vitamin C may vary. So in that sense, it's something that if you haven't done any, um, you could start with some and start with one rather, see how you tolerate it, and then build from there. Then for ones that have a slightly more like creamy consistency, but also a little bit more of the splurge is a brand called Skin Better Science, and they make one called Alto Defense. So the CE ferulic is more of a liquid consistency. This Skin Better Science Alto Defense has more of a creamy consistency. And then one other one that's great, especially good for sensitive skin, is the brand True Skin, which has a lot of love on Amazon too, and it's affordable. And they have a really nice vitamin C um, that uses a more gentle version of vitamin C compared to the others. So if you're somebody who's has a harder time tolerating different products, that can be a great one. I am going to just write in here the SkinCeuticals CE ferulic. And I think it's a good point to mention that just because a product is expensive doesn't necessarily mean that it's better or the best. So with skincare, there's definitely a lot of variability in terms of finding what's right for you. So don't feel that just because something's expensive, it has to be the one. Um, I should mention though, Drunk Elephant does have another version of like a CE and a ferulic acid called their C Firma Fresh. And that one actually they've created, so to help minimize the oxidation issue, they've created a bottle where you actually essentially mix it at home. So it comes in a powder and you mix it together. Some ways to also help preserve your vitamin C to make it so it lasts longer and hopefully won't oxidize as quickly is making sure to keep it in sort of a dark area. Don't leave the cap open. So if you're doing your vitamin C and then you put it down for a minute to go and do other things in the bathroom, that exposure to both light and air can destabilize it. So just making sure to avoid that when possible. Um, okay, the Beauty Stat vitamin C is an amazing one. So that's also a great one, and definitely a fan of that one as well. I do like, okay, so in terms of makeup, so best skincare and makeup for clean ingredients, um, totally get it. So I happen to love Ilia as well. I think Say Beauty is another one that's great. I would say from a skincare perspective, there's the brand Vanicream, which is a great brand all around, also in the setting of skin sensitivity can also be good if somebody's more skin allergy prone. But again, when going through chemo and radiation where the skin may be more sensitive, it's a brand that's eliminated a lot of fragrances, preservatives, parabens, all the things, but yet still has really great products. And I should add, they have a really great vitamin C. And so I think that their sunscreen, their vitamin C, they even have shampoos. So I definitely like beginning to end from their brand. True Skin is also another brand that is natural and has a great vitamin C as well. For Yes, Youth to the People is also a great one. I also love hearing your recommendations. So definitely if you have something you like, put it in the chat because we can all learn together. And I know there's so many products out there that there's only so many that I can try. And so I love to hear things that you guys are liking. For darker skin tones, is vitamin C sufficient to help with discoloration or hyperpigmentation? So I say yes and no. So it's definitely a part of the hyperpigmentation treatment algorithm, and some vitamin C products may be better than others, meaning they may also have other ingredients or by themselves may be sort of at a level that helps with pigmentation. But typically for discoloration or hyperpigmentation, some other ingredients can also be helpful depending on the extent. So this is when retinoids actually can be helpful. There are some dark spot specific correcting ingredients. So actually La Roche-Posay makes a new serum that came out called Mela B3, which uses a new patented ingredient of theirs called Melasil, which helps with discoloration.
Yes, I have that, and they make a soap too now. I
Yes,
haven't tried the
now
soap, but I have the serum.
yeah, so that's been a new exciting ingredient. So definitely worth checking out. Other ingredients to look out for discoloration are azelaic acid, which can be found in a prescription form or in different brands. Naturium has one, The Ordinary has one. And that ingredient I'm going to write down here in the chat is azelaic acid, good for discoloration. So that's an ingredient that sometimes can be good for pigmentation. It can be good for redness. It can be good for rosacea. It's safe in the setting of pregnancy, if that's relevant. And in general is overall a little bit easier to tolerate when compared to retinol. So again, a great option. I personally used it and love it. Glycolic acid, lactic acid, mandelic acid. So in the exfoliating acid family, those can also be very helpful for hyperpigmentation. Let's see, hyperpigmentation. And then the big one would be something like a hydroquinone. So hydroquinone can be a little irritating on the skin. So if you are somebody who's interested in that, that's something that's worth checking in with a board certified dermatologist, understanding the nature of the discoloration, if it's related to melasma or if it's related to sunspots, and deciding based on that. Okay, so in terms of the post-radiation dermatitis and telangiectasia discoloration, so lasers actually are safe and effective. I would say the amount of time to wait generally varies based on
Oh, okay, I'm done with this.
person.
Pretty dry.
Generally depends on the person specifically. So what I would say is that's something first to discuss with your radiation oncologist, but sometimes like a year out is usually sufficient if needed. Sometimes some of those changes may improve with time, but we do have different lasers. In terms of how effective they are, it honestly can vary. Sometimes people, regardless of how well it improves, it can take several sessions. So I would say 4 to 6 sessions um, is usually the minimum. And then we see, depending on how deep those blood vessels are in terms of the telangiectasias, determines how well it's going to respond. But I do certainly think it's reasonable as an approach to try. Um, and in terms of, is there a concern for laser hair? No, so laser hair removal should be totally fine. I would say when you're not actively going through radiation, certainly shouldn't be an issue. If you're doing it on other parts of the body that aren't receiving radiation, that also should be fine. But again, these are all things that I would say can vary on an individual level. So generally still good to speak with with the radiation oncologist just to make sure they feel okay with it. But yes, laser hair removal should still be okay. I think it's extra important though, especially if it's in areas where maybe did receive radiation, that you make sure to go with laser hair removal. Obviously, it can be done at lots of different places and med spas, dermatology's offices. In that setting, I usually would say it's extra important to make sure you're seeing a board certified dermatologist to ensure that you're getting proper treatment, proper settings, and make sure it's somebody who's familiar with the treatment itself. So sun exposure with immunotherapy. So immunotherapy treatments maybe don't make you quite as sensitive to the sun in the same way as some of the chemotherapies, but you still can develop rashes related to the immunotherapy that can subsequently worsen with sun exposure. So I would say it doesn't necessarily come with the same exact risks, but there definitely are skin related issues that can arise. And so if you do notice any rashes or issues in the setting of the immunotherapy treatment, that's definitely something that you'd want to bring up to your dermatologist or oncologist just to make sure that they're giving you the proper treatment for that as well. And okay, our microneedling Botox, so yes. So what I would say in terms of lasers and treatments, like microneedling, Botox fillers, so definitely all okay, but I usually say to wait until after treatment. The reason for that, particularly, I would say, is more so during chemotherapy, honestly. And that's just because with all these things, we're creating little openings in the skin, and that can sometimes increase your risk for infection. And so if while on chemotherapy, your immune system isn't working as well, it may be at greater risk of infection compared to otherwise. But that being said, I would say you got a diagnosis and 2 days later you want to do Botox, there is no problem to do that. And so all these things I would say are definitely fair game, but just sometimes it depends a little bit of nuance as to when. In terms of, let me see if there's anything more to add. I don't know if anyone has specific questions on those treatments, but yes, those would all be okay. Nails. Okay. Oh, I, everyone gets a post-treatment glow up. That's the most fun part of getting through the treatments. Okay, touch on nails. So the nails, just like the hair, just like the skin, can undergo their own form of damage in the process of experiencing whether it's treatments or sometimes even just going through a new diagnosis. So I always say that our nails and our hair are responsive to whatever else our body is going through. And so we know that with the certain types of chemotherapy, certain types of medications, our nails can become more brittle, they can break easily. Sometimes they can experience what's called splitting or onycholysis, where it lifts up off of the nail where the nail plate lifts up off of the nail bed and can make it look like it appears like a little bit of a white kind of buildup underneath that's not fungus, but maybe look similar. And the concept here is really just wanting to do the same thing that conceptually we're doing for the skin, where we're moisturizing, we're being gentle, we want to do for the nails as well. So the issue with gel nails is that not so much that they're problematic from a toxic concern, but it's that they actually can be more irritating to the nail itself. And it might not be the gel itself that's the issue. It's actually the removal process. And so some people may find that if their nails are weaker inherently, if they do gel nails and they take them off, then their already weakened nails are even worse. And so I usually would say to avoid it, to be honest. The other thing is that with gel nails, although we don't necessarily know the amount of exposure that happens to actually cause an issue, there have been sort of an association that the light that you use for the gel can potentially increase the risk of skin cancers now and sun damage and photo aging. Now, the idea there is that a lot of the gel polishes don't necessarily use UV light anymore. They say they're doing more LED light. But I think the concept is, even if you are going to do gel nails, be extra cautious about sunscreen, because again, going back to the idea that our skin is a little more sensitive and related to the sun, that can happen with gel nails. So sunscreen and actually wearing those gloves. There's a brand, Mani gloves, that make really cute, like fingerless tip gloves that can be used to help protect the skin from the UV light damage if you do
I
decide to use gel.
personally do the powder, so there's
Mm.
no light at all.
So
That's
yes,
why I like it. Yeah.
yeah, and so those are great. I happen to think that the SE and OPI both have like the 10-day, which I used to be a big fan because I would say they really lasted 10 days. I probably don't get the full 10 days anymore, but I do feel like I went through a long stretch, and I do feel like it gives you a little bit more time with them. Do you have to wait for a discolor? So generally speaking, for nails, it's usually time to grow out. Now, some brands do have like a brightening polish. Actually, Essie has one that's designed to help with discolored nails. I'll try to find the name. But yeah, so generally though, it is mostly waiting. They have a good as new nail perfector. Um, which helps, sorry, to improve. So it's actually like both hydrating and it helps to brighten. Let me write this one down. Oops, sorry, I don't know what I did. Sorry. SC. Yes, press-on nails are also great. So I think I actually am a big fan. The Olive and June ones too. The Impress ones are great. SC Nail Perfector, good as new. Perfect. And then let's see. What other questions? I'm going to try to see if I can find this other one. Perfect. And just making sure there are no other questions that we missed. Stop using perfume. Okay, actually that brings up a great point. So when thinking about different skincare products and what we're doing to try to avoid irritation to the skin, fragrance can be considered an irritant. So I would say it is potentially helpful to avoid. Now, not everyone will be more sensitive to fragrance. And so if fragrance brings you happiness and joy and all that, fine to continue. But it is true that for some people, fragrances may be part of what makes their skin more reactive. So to be mindful of that. And I think it's important to know that even after treatment, your skin may not be as sensitive as it is during treatment, but some people their skin does change. And so it is possible that some things that you used prior might not necessarily be the same thing that you'll want to use after. So to answer the question, just to make sure, so essentially they're good for use in the context of the fact that the ingredients are all great. Um, but the idea still behind gel nails is just that sometimes the process of removing the polish can be more abrasive to the nail itself. So it's still fine. And again, I think a big overarching theme to all of this is that there's no one right answer. And if gel nails are what's getting you through, they're totally fine to hang on to. So I would say it's something that if your nails were experiencing a lot of weakening and breakage and things like that, then that would be something to maybe modify. But if you're otherwise doing fine, then stick with it, enjoy them, and don't look back. Yeah, so hair regrowth post chemo. So I think that's actually a really great question and something I did mean to touch on. So I'm glad you spoke about that. So in terms of hair regrowth, so it will happen. And so the main thing is just that we just don't know how quickly, we don't know what the hair will look like. And so obviously those unknowns can be very daunting and overwhelming. I would say things that can sometimes be helpful are um, so minoxidil or Rogaine is something that can be used either in a topical or an oral form. Now, again, you can just let time happen. And so I think that's important to know. There's no reason that you have to feel that you have to do something to help speed up the process. It will happen on its own. But for people who may be interested in doing more, minoxidil is something that can be considered and doesn't have any additives that have any hormonal issues in that regard. People who also may be interested in something called PRP or platelet rich plasma, which is a in-office procedure that's done where we actually draw the blood, we spin it down to get the growth factors, then we actually inject it into the scalp. And it's thought that that helps. I always say it's like kind of adding fertilizer to the soil. And so helps to stimulate those hair follicles to start to grow. And so I don't often necessarily see people right away for that, but sometimes if they're like 6 months to a year out and they're trying to sort of speed up the process, it can sometimes be helpful. There are a lot of different shampoos and scalp products, I would say, that have come out that are really focused on scalp health. And I think that is very relevant in the setting of post chemo related hair growth is the idea that we're trying to nourish the scalp so that it again is as healthy as possible, and that helps to facilitate hair regrowth. So Dove actually has a line called the Hair and Scalp Therapy. And they actually have a serum that is designed, it has actually niacinamide in it. It has some ingredients in it that can be soothing to the actual scalp, but is also designed to support scalp health and hair density. Another brand that I like to help support the hair growth process is Nioxin and Virtue. And then Vegamore is another one. And they also make like a grow serum for lashes and brows. So sometimes that can be another good option.
Do you know much about colostrum? I've been taking Armor colostrum. Okay, so this is not about post chemo hair. 2 years ago, I had a doctor tell me that I need to be put on a statin. Long story short, I didn't need to be put on the statin, but I took it for like 3 months. It made my hair fall out. And I just, being the cancer survivor I am, I was just like, I'm just gonna let time take it. I don't want to do Rogaine or anything. It was taking forever. Even my hairdresser noticed it. And then started with Vegamore. I started, I think I see something. Armor colostrum, like, game changer. Like, if you like, it's insane. Like, it is making my hair that I lost. Like, I was losing the hair in the front. I think I even sent you a message. I was like, help me with my hair. I don't know how anything about it, like, scientifically, but, like, I took it for 2 reasons. It's supposed to be really good for your immune system. I have not been sick since I've been taking it, and it's been making my hair grow. So, I don't know if there's any science behind that or
So what I would say is we're learning more about colostrum. So the idea here in general is that it may have just like a stimulating effect. So there are people who are doing it for the skin to help both moisturize and nourish the skin, but also maybe help stimulate skin cell turnover and all that, and then similar for hair. So I would say we don't necessarily have a ton of data on it. Now, it doesn't mean it doesn't work. And I would say more often than not, I've had people who anecdotally have had great success with it. So I would say that's something that definitely is, again, fine to do. I have nothing against it. I think probably more to come on the colostrum story in general, because I think we're definitely seeing it popping up in lots of different areas and to help address lots of different things. In terms of the question, can you use any of these hair products while still on chemo? Um, Actually, yes, I would say in general, many of them should be fine. Typically, I would check with your oncologist just to make sure that there's no interaction specifically. Topicals generally should be totally fine to do. The one thing with something like a minoxidil or a Rogaine is that when you use it topically, it can be a little irritating on the scalp. So if your skin has become more sensitive, that would be something to just consider. I think there were a few questions on menopause and skin over 60. So being pushed into menopause due to treatment, I think it is something that is an important thing to consider. And the reason being is that sometimes as we lose estrogen, as we get older, our skin in general, skin barrier weakens and our skin becomes a little bit drier in general. And so the idea there is that even though maybe retinoids sound all well and good, some people can't tolerate them as well. And so I would say there are actually some brands who have really tried to hone in on this and acknowledge that even though we want all the good things that firm collagen or firm the skin, build collagen as we go into menopause, and if we're getting older, we can't always tolerate the same ingredients that we once could. And so these brands are focusing in on novel ingredients or incorporating things like peptides, which might be a little bit more gentle on the skin. So a few brands that I like that, again, you don't necessarily need menopause specific skincare, but what's nice about these brands is they've created serums and moisturizing products that really have an emphasis on gentle but effective. So for that, I like Vichy has the Neo Vadiol line. Stripes Beauty is the new line from Naomi Watts and has like a whole spectrum of different things in terms of moisturizers, serums, cleansers, everything. Vichy, Stripes Beauty, number 7. So another one for the British England family to look into, although they sell it here too. So that's, you can find it, I think, in Target. Number 7 has a menopause skincare line. And we can start with those. I'm just trying to think if there's anything. But the idea really there is that you may want to focus more on things like peptides, growth factors, which are ingredients that are a little more gentle on the skin, incorporated into products that are a little bit more nourishing on the skin. So it's a little bit easier to tolerate, less about drying out the skin. Hyaluronic acid serums can be a really nice option to help boost moisture, and those also have a plumping effect on the skin. So they draw moisture in, plump the skin, hydrate the skin, so improving the appearance of fine lines and wrinkles without necessarily creating any irritation. Um, let me just put that in as well. So let's do for hyaluronic acid serums. I also, oh, actually for the menopause, I also like the True Skin Longevity line cream. And then hyaluronic acid, Vichy Mineral 89, La Roche, Hyalea V5. Does anyone use a hyaluronic acid serum?
Of course,
What's your favorite?
La Roche-Posay, but also it speaking of, let me see if, oh, I have it right here. Because I have a huge bag of La Roche-Posay at my feet at all times. Um, this is only available in Europe.
Mm.
It's when I went on the Lurch Pro Se trip a couple years ago, they told me to get it and they need to bring it here. But yeah, I actually was gonna bring up hyaluronic acid because hyaluronic acid had a moment during, I would say, 2020 COVID and 2021. And then everyone woke up one day and they were like, overrated. I still like it. I feel like it makes your skin hydrated and all that. So I love a hot take on hyaluronic acid.
Yeah, so the oh yes, the Neutrogena Hydro Boost one is a great option too. So what I would say with hyaluronic acid is it's a larger molecule, and so the concern or the reason why people sort of had the different feelings toward it or the pendulum swung is that even though we know it's intended to be hydrating, because it's a larger molecule, we knew that it wasn't able to penetrate quite as deeply as some people may have wanted it to get the most benefit. But what some brands have done is they've incorporated both high molecular weight and low molecular weight hyaluronic acid, which allows for deeper penetration. So it definitely had a moment because the idea was like, okay, let's boost hydration. And then people were like, wait, are we really getting that hydration where we want it? But at the end of the day, the benefit that you're getting with hyaluronic acid is twofold. It's hydration, but it's also that plumping effect. Hyaluronic acid is the same ingredient that's often used when we inject filler. And so the idea is that putting it on topically is not giving you the result of filler, but it does help to boost that moisture overall. And some, I would say, some serums focus more on utilizing it from a helping with fine lines and wrinkles. Some are designed more from a helping with the hydration.
Do you, because I remember I learned this from somewhere. Um, do you need water on the skin pre hyaluronic acid? So I have the La Roche-Posay misting spray. I would put that on my face, like after, so like cleanser, toner, vitamin C, and then I would do the spray with the hyaluronic acid. That's still do that because then I also heard that it doesn't really matter like if you use the water or not. I'm
So
still gonna use the mister. I like the mister.
yes. So the idea there is that hyaluronic acid is what's called a humectant. And so it means that similar to like a sponge, it can actually hold up to 1,000 times its weight in water. So when you put it on the skin, the thought is it's not just doing what it's supposed to do by sitting there. It actually is trying to draw more moisture into the skin. So if your skin is dry when you put it on, it's trying to find that moisture wherever it can. So theoretically, some people are worried that it's pulling it from the skin and basically drying your skin out as a result. If you put water, thermal mist, or dampen your skin, or if you leave the skin damp prior to applying it, then there's more moisture for that hyaluronic acid to hold on to. And this becomes more important, especially if you're in like a dry environment where there's no moisture in the air for that hyaluronic acid to grab onto either. So it does definitely give some added benefit. Now, some of the formulators of these products have made them with the understanding that they're not necessarily being utilized always on damp skin. So even though it does enhance the benefit, you're still likely getting some benefit. But I think the main thing with hyaluronic acid, though, is to note that even if you're drawing moisture into the skin, you always still need to seal that moisture in. And so either using a hyaluronic acid serum that also has an ingredient that supports the skin barrier, or always making sure to lock that moisture in with a cream on top of the serum is important. So for most people doing a hyaluronic acid serum, if they're doing it in the way that you're describing, where it's a cleanser, maybe then the mist to get the damp, then the serum, and then a moisturizer on top. And people have called this technique skin flooding because you're flooding the skin with lots of moisture. And getting back to the over 60, or for somebody who's like, I want to do something with my skin, but it does feel more sensitive after going through menopause or whatever it may be, the hydration is really number 1, 2, and 3 in terms of steps that are going to give your skin that dewy, plump, healthy appearance without necessarily causing any kind of irritation. With cold capping, the skin is getting dry using the Aveeno apple cider. So what I would say is this may be actually worth seeing about actually adjusting some products. So sometimes in terms of the wash that you're using, doing something that's even more gentle on the skin, sometimes moisturizing. Actually, the thermal spring water can be a nice option. So the La Roche-Posay mist can be a great option to spray onto the scalp as well, because that can help to soothe the skin there. Um, but in terms of being too gentle, I feel like that's probably okay. The one thing is it sometimes scalp dryness and oily scalp can sometimes be sort of conflicting, meaning when we experience flaking on the scalp, sometimes it's actually related to too much oil, which is where using like salicylic acid or a anti-dandruff shampoo can be helpful, as opposed to when we experience dryness of the scalp. So when it feels tight and flaky, when that and in that setting, using a more hydrating shampoo can be helpful. The apple cider vinegar may be swinging more towards like if the flaking is more from an oil perspective. So maybe using just like a very gentle Aveeno hydrating shampoo. But again, I don't know without seeing it. So hopefully that still helps. But actually using some of the baby shampoos, I think when the scalp is when you are undergoing different treatments can be actually helpful. It generally is mostly that a lot of it's marketing, but a lot of it's also that they're designed to be formulated to be a little bit more gentle on the skin, and tend to be less fragrant. CeraVe actually just came out with a shampoo um, that is a gentle hydrating shampoo, and it's fragrance free. So similar to like Vanicream, where maybe if we're looking for in products with few ingredients, it's very hydrating on the scalp as well as the hair. Coconut oil, I would say, can definitely be great for dry scalp, but this is where I sort of distinguish between flaking that's a result of dryness and flaking that's a result of oil. So oil we call like seborrheic dermatitis or the dandruff, and coconut oil can actually worsen that type of flaking. So that's important to know. Sometimes the yeast that uh, cause the dandruff can actually feed off of the coconut oil. But if it's more dryness, which is what it sounds like you're alluding to and definitely would make sense, I think coconut oil can be a great option to help moisturize and nourish. So I think that sounds good. As long as it's working, you get to keep it. So in general, I would say if the scalp is just feeling dry, I actually do feel like these hydrating shampoos tend to be a good option. These tend to be the ones that will actually say hydrating shampoo. So Dove makes some great ones, that hair and scalp therapy. The CeraVe, actually, one that I just mentioned, is one that I'm recently using and I think can be a really great option because it's super simple and gentle on the skin. Sorry about that. Somebody came into my office. And so those are both great options, but otherwise, sorry. Uh, Otherwise, I would say it's more just a matter of finding one that you like. And then for that, also, obviously, conditioner can be helpful, but that's where some of these scalp therapy serums are nice. The one that I mentioned from Dove is a nice hydrating one. And scalp is definitely having a moment. So if you even just look in the hair care aisle, the amount of scalp related products has probably doubled since, I mean, maybe tripled even since last year, just the amount of brands focusing on it. So definitely try to think about that as well.
I've got another question. I know we could be here all night. I promise I won't keep you all night. Um, it's so important to wear sunscreen every day. But my question is, what about sunscreen that's in a moisturizer? Obviously I wouldn't wear it like if I'm like laying by the pool. I would put that on, and by the time I get to the pool, I would like put on whatever, or sit in the shade, or like I really want to get one of those like face shields so like my face doesn't see the sun at all. Um, I love the Dermatology tinted moisturizer. It
Mhm.
gives a nice glow, but also it has the SPF in it. Um, yeah, my question is, am I protecting myself enough? I know you're supposed to reapply your sunscreen every 2 hours. But curious, your thoughts on using the moisturizer that has SPF in it.
So I think, and myself included, I think it's very realistic to use a moisturizer with SPF for every day as part of your daily routine. I think it generally, as long as you're applying enough of it, you're going to get the benefit of sunscreen. The reason not to use it, or the reason that we sometimes will question mark it, and again, this is just speaking about sunscreen moisturizer combos, not makeup sunscreen combos, but sunscreen moisturizer combos, as long as you're applying enough of it. And it really goes back to doing that same like 2 finger rule. So I always say, even I've used that Dermatology Universal tinted as well, but I apply it as though I'm applying a sunscreen. And so you want to make sure you're putting enough of it on. But yes, I think for day to day, that's okay as long as you're getting enough of it. But if you are going to be in the sun for an extended period of time, finding a sort of primary sunscreen is definitely going to give you essentially a greater chance of greater protection, because typically you're going to probably be more intentional about putting more of it on and you'll get more of the benefit. But there's also what I would say are hydrating sunscreens. So looking for sunscreens that are formulated with hyaluronic acid or ceramides or different things can also be another way to find a sunscreen that won't be too drying on the skin either. But I do think combined moisturizer sunscreens are great. And I would say from a something is better than nothing perspective. So if you have a moisturizer with SPF that you like and you're using it, no reason to stop it. Just exactly as you described. If you're going to be going to the beach, make sure you put that extra layer on when you are out in the sun.
Well, this was a great event chat. Thank you so much, Dr. Garshick, for answering all of our questions and for staying extra late at your office to answer our questions. We really appreciate it.
No,
Everyone enjoyed it, and we're going to have to do one of these again. Thank you so much. I'm going to have you share how people can find you. Yeah.
sending it over now. And thank you truly for having me, everyone. I loved the questions, and I was truly so honored to be invited to speak to all of you. And as questions come up, as you go through different phases, you can always reach out to me. I am here for you. And you can find me on Instagram, message me, email me, whatever it is. If you're local, happy to see you in New York or New Jersey. But hopefully we get to do another one. And if anything comes up in the meantime, just let me know.
Thank you, Dr. Garshick. Thank you, everyone. We'll see you next time. Thank you.